Hi, Dr. Sasse here from Sasse Surgical. I just want to revisit the important topic of type 2 diabetes and metabolic surgery and how metabolic surgery has become a standard treatment for managing type 2 diabetes. In many cases it can be curative, in many cases it can put type 2 diabetes into a remission mode, and in many cases it reduces the severity of type 2 diabetes. But the reason I want to revisit it is because it's going to be an ongoing conversation, and it's going to continue to be something that is talked about a great deal going forward as the explosion of numbers of people with type 2 diabetes continues, and as the understanding of how metabolic surgery works continues to unfold. Even though today we have widespread adoption of the recommendation for metabolic surgery as a treatment for type 2 diabetes today, and by that I mean something like over 70 of the leading endocrine societies that produce guidelines around the world now endorse metabolic surgery as a mainstay of treatment, including the American Diabetes Association and other clinical endocrinology societies. But despite that, we really have a very low fraction of people with type 2 diabetes that really know that this is a recommended treatment, and certainly a tiny fraction who move forward with metabolic surgery to treat their type 2 diabetes, even though the evidence would strongly argue that it is the best treatment for type 2 diabetes. It is the safest treatment, and it is the one that gets at those root causes of the metabolic or hormonal abnormalities of type 2 diabetes. And that's why it reduces the risk so much. That's why we have such profound reductions of heart attack, stroke, kidney disease, blindness, and amputations when people do have metabolic surgery versus continuing with shots and pills and standard, quote, standard prior treatments. I saw a gentleman recently that I thought really epitomized this kind of divergence of the way this treatment is perceived. He has had a diagnosis of type 2 diabetes for 16 years, and he started on insulin about 7 years ago. And just recently he came to see me with some reluctance because he felt like he was sort of losing ground on his battle with weight, which was gradually increasing, and with the diabetes because his medications are continuing to increase, and there's a certain frustration and cost and frustration, I guess, just in the gravity of having this worsening condition, that he finally reluctantly agreed to come see me at the recommendation of one of his doctors. And we got to talking, and he did have an understanding that type 2 diabetes eventually was likely to lead to some of those adverse consequences as the years go by, and that it affects the blood vessels, that it does cause strokes and heart attacks, and the kidneys can be damaged. He's already experiencing some neuropathy, so he understands that losing toes and amputations are a real possibility. But he really was very concerned that metabolic surgery didn't always work, and that he knew an example of somebody who had regained all their weight. And so in his mind, that seemed to undercut the credibility of the surgery as a valid treatment. And so I guess I would just like to address that by saying that metabolic surgery really should be viewed just like any other treatment for any other disease. It is not perfect. In fact, in some ways it's more imperfect than a lot of other treatments. But just keep in mind that when we choose a medication to treat, let's say, blood pressure or diabetes or any condition, you know, how it works on that one person is going to vary a lot. You get that bell-shaped curve. You'll get people for whom it works amazingly well, maybe too well, maybe it lowers their blood pressure too much. And then you'll get most of us in the middle, and then you'll get some at the other end where it doesn't work at all, or it causes a bunch of kooky side effects and they have to stop taking the medication. In this case, though, the treatment is surgery, and so it seems, I think, much more important that it be 100% successful, you know, before I go sign up to have surgery. And while there's some truth in that you don't want to just embark upon surgery lightly, I think we should also put in context that the surgery has become much more targeted and less invasive, and with the sleeve surgery in particular, it's safer than an appendectomy, a hysterectomy, or a gallbladder operation. It takes about 45 minutes and is far, far safer than not choosing it for treating type 2 diabetes. based upon the large longitudinal studies looking at Americans and people in other countries too who did and didn't have weight loss surgery. And so to sort of throw the baby out with the bathwater, because there are people for whom it doesn't work, or people for whom it works for a while but then the weight comes back on, which by the way is true in a good 10 to 20% of people and maybe higher in some longer term studies, that doesn't mean that it still isn't the best treatment for type 2 diabetes. I tried to just describe for him the data and have him just simply think about this as any other treatment for diabetes. And the data is very compelling that among people who have this kooky little 45-minute surgery, their risks going forward from diabetes are dramatically reduced across the board, from the heart attack, stroke, kidney problems, to the amputations, blindness, and also just plain old mortality risk. So while not perfect, just like any other medication or any other treatment, it is a powerful risk reduction tool for people with type 2 diabetes. And certainly in a case like his, where he's now had the disease for many years, it is a powerful risk reduction tool, and it really is the only one we have which bends the curve so dramatically. I don't want to tell him that, he shouldn't move ahead now, but certainly I wish I could have gotten to him 7 years earlier as he was, say, starting his insulin regimen. We very likely would have reversed the diabetes altogether, and he probably never would be on insulin at this point. If I had gotten to him 14 years ago at the time of his diagnosis, that would have reversed the type 2 diabetes in almost complete certainty, and there's a good chance that now, 14 years later, he either would still not have the disease at all, or he would just be on oral medications for it and it be at a milder state. The difference is that in those 14 years, that disease has already done a great deal of organ damage. There's already been progression of his kidney disease. There's already neuropathy. There's already small vessel disease that has set in the brain, in the heart, and in the extremities and in the kidneys. So focusing on the fact that the metabolic surgery is not perfect or it didn't work for, my sister-in-law misses the big point that it is the most powerful risk reduction tool for type 2 diabetes. And I would also throw in that in those cases where it, quote, doesn't work, we have other cards to play. So in the patients who do have a sleeve procedure and they didn't get a big oomph from it, it changes our hormonal chemistry somewhat, but if it didn't result in a large amount of weight loss and reversal of diabetes, we then do a second step procedure with a duodenal switch in order to achieve that stronger hormonal response and really try to reverse the type 2 diabetes then. So focusing on its imperfection is missing this larger point that it's the most effective tool. And until we have better treatments, we really have a very small voice to kind of let people know about this highly effective treatment. Big Pharma has billions of dollars that go toward promoting and advertising shots and pills approach to diabetes, despite the data demonstrating this massive risk reduction from a 45-minute surgical procedure. And there really is no giant, industry megaphone that is explaining that data. So it's important for us to kind of understand it, and as providers and doctors and nurses be able to convey that. But also if a loved one of yours, a family member, or you yourself are wondering whether type 2 diabetes, makes sense to treat with surgery, it's at least worth examining the data. You can certainly read more about this on things I've published on my blog at Sasse Surgical, or on the book on that topic, the type 2 diabetes cure, and I really go through that data in great detail. I think the data really speaks for itself. Of course, having been exposed to it, of course, you can hear in my voice the passion for it, and I think we try to stay objective about it as surgeons, but I think the data really speaks for itself that this really needs to be examined by far more individuals and not focus on its imperfections. All right, I hope that sheds a little light on this fascinating topic as it continues to evolve, and I wish you the best of health.